Hip pain in young athletes is very common, as well as not only young athletes, but as well as middle-aged adults. We see this with activity. This is mainly pain that occurs in the front of the hip with activity as well as prolonged sitting. The most common thing we see in the hip is labral tears, and what happens, instead of the hip being perfectly round when you flex the ball into the socket, it becomes a little bit oblong, and we have this mechanical abutment or hip impingement where the femur bumps into the socket, into the labrum on the edge of the socket, and can lead to tearing. We try to manage that conservatively. We treat it first with injections and therapy and anti-inflammatories. If that fails to provide relief, surgery is certainly an option. It's an outpatient surgery. We do most of our surgery at Apex Surgery Center in Westmoreland. It's in and out the same day. After surgery, you're able to put weight on your leg after about 2 weeks. So you have 2 weeks on crutches. You do have to take an anti-inflammatory for a month afterwards. We shave that bone down surgically, and that creates a lot of bone dust, which can go into the muscles surrounding the hip and can lead to that bone conglomerating. So the anti-inflammatory significantly decreases that risk. You start therapy right away before you come back to see me. Early motion is very important after surgery. And then you also have narcotic pain medications for a few days afterwards. You're on crutches for 2 weeks, you're back to running around 3 months, and then back to sports around 4.5, 5 months.